Well, we begin in Ontario. The province's top healthcare unions have proposed measures they say will help tackle major staffing shortages. Some hospitals have cut back on services or even temporarily closed emergency departments because they can't find or retain enough workers. The unions warn if the government doesn't act now, Ontario's healthcare system could collapse.
We have heard from Premier Ford that he claims that Ontarians have access to the care they needed. I'm here to tell you that's simply untrue. We're here today to call again for this government to take immediate steps like yesterday, to keep the nurses we have, bring back the nurses who have left their jobs, and bring on board new nurses.
The CBC's Megan Fitzpatrick is on this story for us. She's at the Ontario Legislature in Toronto with more on the plan proposed by healthcare unions.
Well, one of them called for a life raft, Hillary. That's how she phrased it, saying that is what is needed right now, that the healthcare system is failing in Ontario. That was another phrase we heard at this news conference. And they say this is a crisis that's affecting nearly every corner of the province, hospitals in Northern Ontario, rural areas of the province, and big cities like right here in Toronto, dealing with staffing shortages. And they outlined in their news conference the consequences that that's meaning for patient care in this province. And so to address this, they are calling for Premier Doug Ford to sit down with them and talk to them and take a few immediate steps, 5 of them that they outlined. One of them includes supporting the existing workforce by doing things like offering more mental health support, by offering on-site support like childcare. They say these are the kinds of things that would help the existing workforce. They also talked about wages and saying that wage increases are needed to both retain the workforce and also bring back people who left. And they say the reason some healthcare workers have left the field is because of Bill 124. That is a law that the Doug Ford government brought in that capped wage increases at 1% for public sector workers over a number of years, including nurses. And so these unions were calling on Doug Ford to scrap Bill 124. They're calling for financial incentives. They're calling for more spots in post-secondary education for healthcare workers. So a range of solutions that they say need to be put in place and need to be put in place fast. But a lot of what we heard at this news conference too was about the challenging conditions that healthcare workers are facing right now. Take a listen.
We have a workforce that is exhausted, demoralized, and looking at the door after toiling through the pandemic, suffering real wage cuts, and working in an environment that is often unsafe for them. Frankly, we need to make working in hospital better paid and safer. And we need to staff up our hospitals to deal with the workloads, which are impossible and which threaten the quality of patient care.
Now, they did make the point that this is not exactly a new crisis. They were saying that the hospital system in Ontario was underfunded for years, and that even before COVID-19, there was a staffing problem and a staffing shortage. They have an estimate right now that there's at least 20,000 unfilled positions within Ontario hospitals. So things are pretty bad, and they also were warning that things could get worse unless some action's taken by the government.
And Megan, on that front, is there any response from the government yet to any of these proposals that we've heard?
Yeah, well, they say they are taking action, and they have been for quite some time. A spokesperson for Sylvia Jones, the health minister, writing in a response to the union's news conference, outlining some measures that the government's taking, like a $5,000 retention bonus, they called it, for nurses. That was announced a few months ago. But what we heard at the news conference is that not every single nurse in the province was eligible for that bonus, and those who were eligible didn't all get the full $5,000. The government also talks about launching the biggest retention and recruitment strategy in Ontario's history. They also make the point that Ontario is not the only province facing a staffing shortage crisis within its hospitals. Another measure they're pointing to in terms of what they're doing is working with the colleges of nurses and physicians and surgeons to speed up the process for certifying internationally educated healthcare workers. Yesterday, the health minister sent a directive to those regulatory bodies instructing instructing them to report back to her within just 2 weeks with new plans on how they're going to speed up the process. The College of Nurses says they've already been trying to do this. They've changed their language proficiency requirements, for example. They have been working with the province to supervise the practice hours that need to be done. They say they will respond to the government and keep working on solutions. So the Doug Ford government in general defending how it's handling this, but this is sure to be a hot topic next week, Hillary, when the legislature here at Queen's Park resumes for the first time since the June election.
CBC's Megan Fitzpatrick for us at the Ontario Legislature in Toronto. Thank you.